Another reason is that we must be able to relate the maxillary cast to the opening axis, and for this we require a Facebow transfer. We are currently demonstrating on the Denar system, as this is one of the simplest ways to record articulation. There are several equally good systems on the market, and a general understanding of the principles of articulators would be essential. But that's a different story to be told another day. My colleague, Lawrence Aitken, will demonstrate on Tina Horton, who is also a dentist working at the London Hospital, on taking a Facebow record. Of course, there are many inaccuracies with the system, but by using a system that at least minimizes inaccuracies, we are working even closer within the patient's physiologic capacity to adapt. The Denar Slidematic Facebow makes the taking of a Facebow record simple and quick, reducing the chairside time necessary, but maintaining a good degree of accuracy. The Facebow consists of the measuring bow, seen here, which is adjustable in a straight horizontal plane to accommodate different facial widths. The bow possesses these two earpieces for ease of location of the arbitrary hinge axis, avoiding the time-consuming necessity of measuring the arbitrary hinge axis. These earpieces are placed in the external auditory meatus. The built-in reference pointer aligns the bow with the horizontal reference plane, which is 43 millimeters above the incisal level of the anterior teeth. The bite fork here forms part of the transfer jig assembly, which is used to transfer the cast to the articulator. The transfer jig is tightened with these lock screws, which are easily accessible from the front. In the kit, there is also the reference plane locator and the reference plane marker. Prior to placement of the Facebow on the patient's face, it is necessary to mark the anterior reference point on the patient's right side using the reference plane locator and marker. This point is 43 millimeters above the incisal edge of the maxillary incisor teeth. The bite fork is then covered with 2 thicknesses of base plate wax which has been softened. Standing behind the patient, the bite fork is then placed in the patient's mouth, aligning the patient's midline with the index ring of the fork. Only use a light pressure to place the bite fork in the mouth, as only the cusp tips of the teeth are needed. The patient now holds the bite fork in place. It is important that the patient does not bite with the mandibular teeth to hold the bite fork in place, as this could dislodge the bite fork from its true relationship with the maxillary teeth and result in an inaccurate transfer. The reference pin is then attached to the measuring bow with the wing nuts loose, and the bow is assembled on the patient's face. The earpieces are then placed in the patient's ears. The anterior reference pointer is now aligned with the anterior reference point, and the finger screw is tightened. When the anterior reference pointer is aligned, the finger screw 1 is tightened, followed by finger screw 2. The finger screw on the measuring bow is now loosened, and the entire Facebow is removed from the patient.
In order to locate centric relation, I use an anterior jig and chin point guidance. First of all, I shall place some lubricant onto the anterior teeth so the jaw doesn't get locked onto these teeth. Next, I shall take the jaw which has already been mixed up here, and press this onto the palatal surface of these anterior teeth. I'm just going to get Tina to close to make sure she will contact the jaw jig. And open again. Okay. Now I'm just going to hold this until the jaw sets. Once the jaw lay has set, we can now go back to Tina's mouth and take the jig out. Here we have the jig. This is the palatal surface and the indentation of these anterior teeth. If I turn this over, we can see the area of the jig where the lower anterior teeth are going to contact. And it's going to be an area around here. Now the next step is for me to adjust this jig so the lower teeth are contacting on an inclined plane. In order to take a centric relation record, we will use the anterior jig and my chin point guidance to position the mandible in a centric relation position, and we also need a recording medium to record the position between the posterior teeth. Now the medium that I'm going to use is soft base plate wax, which will be warmed. This is a medium that will not displace the mandible from its true centric relation position, but when chilled will capture that position. Okay, open Tina. I'll now place the jig onto her teeth. Wax is now warmed, and I shall place it into Tina's mouth, onto the maxillary teeth, bending the corners very slightly, making sure I don't touch the gingival tissues. Open for me. And just relax and slowly close and squeeze and stop. Now she stopped when she touches the anterior jig. Open and close and open again. Okay. Here we have my wax record, and if I have my study casts with me, I can now verify this centric relation record. There are other recording medium that you can use, such as Duralay, and that medium would be just as accurate, if not more accurate.